Imagine waking suddenly in the dead of night, not from a bad dream, but from an overwhelming surge of terror. Your heart is pounding, your breath catches in your throat, and a cold sweat breaks out all over your body. You're wide awake, fully conscious, yet gripped by an inexplicable, intense fear. This isn't just a nightmare. This is what millions of people experience as a nocturnal panic attack. These sudden episodes of intense fear, which pull you abruptly from sleep without an apparent trigger, are formally known as nocturnal panic attacks. They mirror the severity of daytime panic attacks, but present unique challenges because they disrupt the very act of resting, profoundly affecting sleep and overall well-being. Today, we're going to explore what exactly night panic is, why it happens, and most importantly, what can genuinely help you navigate these challenging experiences. We'll break down a complex topic into clear, understandable segments, offering practical insights and evidence-informed guidance. So, what exactly is a nocturnal panic attack? It's characterized by an abrupt awakening accompanied by overwhelming fear and a range of very real physical symptoms. These symptoms typically peak within about 10 minutes, feeling incredibly intense, before gradually subsiding. Common manifestations are quite vivid: a racing or pounding heart, a feeling of shortness of breath, like you can't get enough air, or even a sense of choking. You might feel chest pain or a heavy pressure, experience profuse sweating or sudden chills, and your body might tremble uncontrollably. Nausea, tingling or numbness, and dizziness are also common, all coupled with an intense feeling of terror or impending doom. Research even suggests that breathing symptoms can be particularly severe during nocturnal attacks. It's important to understand that while alarming, a nocturnal panic attack is distinct from a night terror, though they are often confused. The key difference lies in awareness. During a nocturnal panic attack, you fully awaken and are completely conscious of your fear and symptoms. You remember the event clearly. In contrast, someone experiencing a night terror remains partially asleep, often screaming or thrashing, but typically lacks awareness of what's happening and usually doesn't recall it upon waking. Night terrors are more common in children, while nocturnal panic attacks primarily affect teens and adults. Knowing this distinction is the first step toward finding the right kind of help. Now that we understand what it feels like, let's explore why it happens. The exact causes of nocturnal panic attacks are not yet fully understood, but several factors are known to significantly increase their likelihood, often working in combination. One of the strongest links is with panic disorder itself. A significant number, as many as 7 out of 10 individuals diagnosed with panic disorder, also report experiencing these nocturnal attacks. This suggests a deep connection to the underlying mechanisms of panic. Beyond panic disorder, other underlying mental health conditions play a crucial role. Anxiety disorders, including generalized anxiety, social anxiety, or agoraphobia, as well as depression, bipolar disorder, obsessive-compulsive disorder, OCD, and even issues with anger or hostility are all linked to an increased risk. This highlights the complex interplay between our emotional and psychological states and our sleep.
There's also a genetic and biological component. Brain chemistry and genetics are considered contributing factors, particularly specific changes in brain function related to the amygdala, which is the part of our brain that governs our fight or flight response. Some individuals may have a genetic predisposition that makes them more vulnerable. Stress and trauma are major players. Chronic, unresolved stress or traumatic life events can act as significant triggers, creating a heightened state of alert even during sleep. Sleep disorders and poor sleep habits also create a vicious cycle. Conditions like insomnia or sleep apnea can disrupt the architecture of our sleep, exacerbate anxiety, and make us more prone to panic. It's a feedback loop where poor sleep fuels anxiety, and anxiety in turn disrupts sleep. Finally, substance use can be a significant risk factor. Substance use disorders, including alcohol use disorder, and excessive consumption of stimulants like caffeine or nicotine, are all recognized as increasing the likelihood of nocturnal panic. Some researchers also propose a vulnerability theory, suggesting these attacks might occur when individuals feel a heightened sense of vulnerability and anxiety before sleep, fearing a diminished ability to respond to perceived threats while unconscious. It's as if the mind struggles to truly let go and rest. The good news is, if you or someone you know experiences night panic, there are effective strategies to help.
Treatment approaches for nocturnal panic attacks generally mirror those for daytime attacks, often involving a combination of psychotherapy and medication, alongside important self-care. Cognitive behavioral therapy, or CBT, is a leading psychotherapy approach. It helps individuals identify and modify thought patterns and behaviors that contribute to panic. CBT teaches essential coping skills, strategies to counter nighttime anxiety, and techniques to recognize anxiety-triggered symptoms. Experts like Dr. Jonathan Hubbard, Dr. Martin Antony, and Kimberly Quinlan, LMFT, are deeply involved in applying CBT for panic. Medication can also play a vital role, often alongside therapy. Antidepressants, specifically selective serotonin reuptake inhibitors, SSRIs, like fluoxetine, Prozac, paroxetine, Paxil, and sertraline, Zoloft, are commonly prescribed. Serotonin and norepinephrine reuptake inhibitors, like venlafaxine, FXR-XR, and even tricyclic antidepressants may also be used. These work to balance brain chemistry over time. For rapid relief of severe symptoms, anti-anxiety medications like benzodiazepines, e.g. alprazolam, Xanax, clonazepam, Klonopin, diazepine, Valium, can be very effective. However, it's crucial to know that they are typically reserved for short-term use due to their habit-forming potential and the risk of tolerance. This is a significant point of discussion in treatment planning. Beta blockers, such as propranolol, Inderol, can help reduce the physical symptoms associated with a panic attack, like a racing heart, by blocking the effects of adrenaline. Beyond formal treatment, self-care and lifestyle adjustments are incredibly powerful. This includes avoiding caffeine, alcohol, and excessive sugar, especially before bedtime, as these can disrupt sleep and heighten anxiety. Engaging in relaxation techniques like deep breathing or meditation, maintaining a consistent sleep schedule, eating a balanced diet, and exercising regularly are all fundamental. Seeking support from loved ones also provides a vital buffer.
It's also worth addressing underlying misconceptions. For instance, panic attacks and anxiety aren't identical. Panic attacks can occur without an apparent anxiety trigger. Also, while terrifying, panic attacks are generally not life-threatening, and fainting is actually quite rare. Deep breathing helps manage symptoms, but it doesn't necessarily stop an attack completely. And interestingly, while avoiding triggers might seem intuitive, some therapeutic approaches, like exposure therapy, actually encourage confronting triggers to build resilience. The vicious cycle of anxiety and poor sleep is a frequently discussed challenge. Breaking this cycle often requires a multi-pronged approach, addressing the anxiety with therapy and lifestyle changes, while simultaneously improving sleep hygiene and treating any underlying sleep disorders. Conclusion. We've covered a lot today about nocturnal panic, understanding its distinct nature, exploring the many factors that contribute to it, and outlining the effective treatments and self-care strategies available. Remember, waking up in terror is a distressing experience, but it's not something you have to endure alone. If you or someone you know is struggling with nocturnal panic, reaching out to healthcare professionals is a crucial step. Institutions like the Cleveland Clinic, Mayo Clinic, and Johns Hopkins Medicine, along with experts like Dr. Natasha Bichlany and Dr. Whitley Lassen, offer invaluable resources and guidance. Understanding is the first step towards regaining control and achieving restful, peaceful sleep. There is hope, and there are pathways to help you feel safe and calm again in your own bed.